Good morning. Happy Tuesday. This is Dr. Kaylee, pelvic floor physical therapist. I'm the owner and founder of the Hope Doctors Pelvic Floor Therapy. Thank you for joining our channel. Make sure that you're subscribing and sharing with your friends. We're going to continue to share a lot more. I've been sharing some exercise shorts throughout the week, and I plan to share some workouts and some yoga and some meditation and all the other wonderful things that we have to offer. But today I wanted to talk about just a general statement that movement is medicine, and like a body in motion stays in motion. It's something that's very important for us to remember. But why would a pelvic floor therapist say that? Because if you've gone to pelvic floor therapy, it's probably likely that you went and there wasn't exercise given, or if you scroll through our shorts and you see some of our exercises, the exercises that were provided for you may not be like the ones that I prescribe. And so maybe they are glute bridges, clamshells, Kegels, right? And these, again, I don't want to say that they're wrong. What they are, though, is they are like the baseline, very foundational level activity. Yes, it's very important that you know how to do a Kegel, but you also need to know how to let go of the Kegel. It's very important that you know how to do a glute bridge, but we also have to make sure that that glute bridge is activating the right muscles and that you're in a neutral pelvis. We also need to make sure that we're doing a clamshell appropriately. I actually use a lot of variations of clamshells, but that is when we don't have activation of the glute muscles and we need to find them. And so if you're at a pelvic floor therapist or physical therapist specifically, because again, I can only speak to physical therapy, occupational therapy is a different realm. I don't know much about that because that's not my training. However, pelvic floor physical therapy, we are very trained in the orthopedic side first. And so I always tell people that. What that means, we know already all the muscles, what the muscles do, their innervation, how to progress exercise, how to prescribe exercise, or we should. If we do not, that's a problem. But we should know those general kind of things already. And so give yourself some grace when you're choosing. Ask them, what is your type of treatment style? Are we going to be working only on body work, hands-on internal work, or are we going to be working on some movement? Are you going to teach me how to move? Is there going to be some ways that I can learn how to implement what I'm learning? That's really important. And so be sure you're asking, and be sure that you give them the opportunity to share with you what exactly they want to do for you. And so movement, again, is medicine. And so today I'm going to take you through just a quick little like meditative standing movement. It's like a standing meditation, but it's a check-in. So what we're doing is we're finding different areas of our body that may need a little bit more love, may need a little bit more care, but it's also just going to help us find some muscles that need some help. So I'm going to set my phone to where we can see a little better. I'm still learning all the editing tricks on my phone, so I appreciate your patience. Let's see. All right. So for my meditative movement, I want you to start in a standing posture. Feet below the hips and then below the rib cage. With your feet, I want you to be really mindful that you're going to spread your toes, and I want you to think big toe, little toe, and heel need to be gripping or on the ground. So you've got big toe, little toe, heel on the ground. Let your arches or your midfoot do what they need to do. If they want to fall, great. If they want to stay up, that's okay. Working your way up the chain, you're now going to soften your knees. So instead of hyperextending, we've got them soft, not in a squat, but just a little soft. From there, we're coming up to the pelvis. The pelvis is going to be like a bowl of water. Hands on the top of where the hip bones are, and you're going to pretend like it's a bowl of water. And I want you to find neutral pelvis. So with it being a bowl of water, if we tuck too far back, it's going to pour out the back. If we tuck too far front, or if our butt's sticking out, it's going to pour out the front. So finding that neutral posture can be really helpful. What do you feel here? Do you feel tightness in the feet? Is it really hard for you to get that activation in the foot? Do you feel equal pressure throughout the feet in this standing posture? What about your knees? Did you notice that they were hyperextended? When you get to the pelvis, are you able to find that neutral posture? Going to the rib cage, bottom of the ribs, they don't need to be flared or open. We want them to be nice and engaged, but they don't lean forward. We are right above that neutral pelvis or that bowl of water. Coming up, shoulder blades, down and back. Let them melt down the spine. You're bringing those shoulders down so that you're feeling nice up and tall. Let the arms rest by your side. And then when you get to your head, we don't want this and we don't want this. You want to be a little bit in the neutral. So you're going to find that neutral where you're looking directly forward, tiny tuck. And then you're going to suction your tongue to the top of your mouth and then bring it back towards your throat to top off that posture. When you're in that position, what do you notice? Do you notice something tight? Does it feel uncomfortable? Does it feel good? And then going from there, when you're in that good standing, natural, neutral position, take your feet, and I want you to pretend like your feet are in quicksand. Now, your feet, so you're in standing still. I'm coming up just so lighting is a little better. I always record these videos when my son is occupied, and it happens to be that he's asleep today. I'm not at my office, so when I record the next one, I'll make sure I have a little better lighting. But when your feet are on the ground, again, big toe, little toe, and heel are equal. You should feel equal pressure or weight throughout both of the feet. You're going to pretend your feet are in quicksand, and I want you to first bring them together. The feet are not moving, the legs are coming in. You're going to feel some engagement or activation on the inner thighs. What does that feel like? Does that cause back pain? Does that make things feel really good? What happens? Same thing, let it go, but now you're going to pull them this way, so you're going to feel some activation in the glutes, sides of the legs. What are you noticing there? A lot of my clients just have a general difficulty with finding the ability to coordinate or activate the muscle. We send the signal, we say we want it to activate, but it's actually really hard to turn on, turn off, do the thing, right? So if that's the case, that's kind of a cue that we're having trouble with coordination, and that's something that we do as pelvic floor therapists really well, physical therapy specifically, because movement is our medicine. And so when we take that, that's just a general set, right? General postural position. From there, we can do different things, like going into pretending there's a karate chop at the hips. We can go into a hip hinge. Do we feel glute and hamstring activation? Do you only feel quad? What happens when you go into that squat? Do you shift to one side? Are you feeling it on the lateral or the outside of the legs or the inside of the legs? What muscles turn on? Same thing, if we go into that karate chop hip hinge and arms down, and what if you rotate? Can you rotate without the pelvis? Can you only rotate the rib cage and add some of that rotation in? If not, then it's possible too that your pelvic floor is not receiving the amount of pressure that it needs to. It's receiving too much. That might be why we're leaking, might be why we have pressure in the pelvic floor. So those are just different things to think about, because again, movement is medicine, motion is lotion, and all of these wonderful things that you hear me say, but it's just imperative to start with the posture. The posture can tell us so much. I am not the posture police. I do not believe that everyone has a perfect posture or should have a perfect posture at all times. It's just not possible. I'm slouching right now to record this video, but it is helpful to go through these postural resets throughout your day. So how I prescribe them or recommend them is just when you remember, when you're standing doing dishes, when you're waiting on the kiddo to get up, when you are cooking. Start from the feet, go all the way up to the tongue, try to just reset things, see how it feels, and pay attention and make note of it. Like, oh, wow, I'm actually noticing a lot of back pain when I move my feet apart and I start to activate that lateral side. That's probably because when we activate the lateral side, your front of the pelvis moves forward, you're tipping your water bowl. Can you keep your water bowl neutral? And give yourself the grace to kind of learn through these things, because again, it's not an easy thing to learn because it's so new, and most of us have been in the posture for a long time. It's a comfort thing, so we're changing that. But I hope that that makes sense. So again, we did a posture reset today. We started to learn a little bit more about that. Next week, what we're going to be doing is we're going to be talking about the hip hinge and the squat specifically. So don't miss that one, because we're going to go over it. I'll have a better lighting situation, but we're going to go over it. We're going to do the movements together, and you're going to learn with me what feels good, what doesn't, and we're going to assess kind of what's going on. But I'll see you then.